Well, one of the key questions in IBD is to predict the prognosis. And not only patients and their families want to know their prognosis, but as physicians we also want to know how the disease will evolve. Since we want to tailor our therapies according to the disease severity, carefully outweighing risks and benefits in Crohn's disease. And in this study we were especially interested to see how the effects were of mucosal healing on the long-term outcome and prognosis in our patients. In this study we used a unique set of patients in which we had extensive data on. This study is actually a follow-up study of a previously published study in The Lancet in 2008. In this study we had newly diagnosed Crohn's patients that we randomized in two arms. The first arm was the step-up arm in which we used steroids from the start and switched to azathioprine only when the steroids had failed, and then only switched to anti-TNF therapy when the azathioprine treatment had failed. This approach was compared to a second approach in which we used the top-down approach, in which we used infliximab from the start using 3 infusions together with azathioprine from the beginning. And in this approach we were able to completely avoid steroids. This study is then referred to as the step-up versus top-down study. Well, we looked at a variety of parameters, both patient and disease characteristics at diagnosis and 2 years after institution of therapy. We correlated these parameters with the clinical evolution in the ensuing 2 years, that is year 3 and 4 after starting therapy. The main endpoint used in this study was steroid-free clinical remission as a very clinically relevant endpoint. Secondary endpoints we chose were the number of disease flares, the need for surgery, the use of other medications, and steroid-free clinical remission without further use of anti-TNF therapy. Well, let's have a look at the results. As you can see on the graph, the only significant predictive factor for steroid-free remission was mucosal healing or not at year 2. 70% of patients that reached mucosal healing at year 2 reached the primary endpoint of steroid-free remission, compared to only 27% of patients with mucosal lesions. All but 2 patients maintained this remission without further anti-TNF treatment. None of the other factors, both at diagnosis and at year 2, proved to have predictive value. We are of course happy to refer you to the full paper for complete results. Well, although more patients in the top-down arm had reached mucosal healing, not the treatment arm per se, but the fact that mucosal healing was reached or not proved to be of predictive importance. And in fact, by measuring mucosal healing, we do 2 things. We look at the effect of our treatment, but we also evaluate the natural history of the disease. And in a way, this study replicates the findings of a large IBD Scandinavian cohort, where they observed that mucosal healing had a predictive good effect. And this study was done before the era of the immunomodulating therapy. This study is commonly referred to as the Ibsen Study. The main message for clinicians in this study is that we should try to aim higher for our patients. As you can see on the graph, we should not be satisfied if patients are doing better. We should maintain them in remission without steroids, and now this study shows that we should also aim for mucosal healing. By reaching mucosal healing, we will improve their long-term outcome and we will avoid complications. In conclusion, this study showed that if we are able to treat Crohn's patients early enough, we are able to reach mucosal healing in a majority of the patients with the currently available treatment options.